This is the login screen of the software. You cannot enter into the software without entering a valid username. Enter your username, password, role, and if you are a doctor you can select your department and log in into the software. This is the main screen of the software. Here you can see new patient, old patient, treatment, IPD, investigation, details, billing, admin and log off button. Now let us select new patient. In the new patient you can enter the name of patient, the gender of the patient, age, contact address and department and doctor he want to consult. The patient ID and the OPD ID is automatically generating numbers according to the software. Now the old patient department. Here you can select any patient ID and continue his treatment or assign him to a new treatment. The charges is charged accordingly to the hospital's requirement. Now the treatment. This screen belongs to the treating doctor. The doctor can select any patient ID, its OPD number and fill in the necessary details like complaint, history of the patient, diagnosis of the patient, and he can assign medicine to be taken. The medicine can be given like number of days and dosage like number of times in the day that medicine should be taken. All this can be printed through a report and given to the patient within the software. Now let's move to the IPD. Here you can admit or discharge a patient. You can select the patient ID of the patient and enter the necessary detail and admit him to a ward and a bed. The next is IPD discharge. Here you can select any admitted patient, see his necessary information like in which ward he is and on which bed he is, and you can fill the charges accordingly and discharge the patient. Now the details. This is the most important section of this software. Here we can generate any kind of report like OPD report, IPD summary and OPD summary. Let us see now the OPD report. Here we can see all the patients who have come to the hospital within the date. Now we can select the report and customize the report according to the situation, like to which department the patient has visited, to which doctor the patient have visited, and between which dates some patient have visited. So now you can select monthly summary, yearly summary or summary of a week, details of a week, reports of a week, reports of a department, report of a doctor. Here you are seeing now OPD summary report. You can see the whole year's summary report, how many new patients and old patients have came. You can export these reports into PDF, Word or Excel formats so that you can print it and you can save accordingly. Similarly, you can see the IPD reports and IPD details. Now you can see the billing section. Here you can select the details of patient like patient ID, OPD ID or patient's IPD ID, and you can enter the details of the bill, like for what purpose the bill is received for OPD bill, for IPD bills, for any medicine bill, or for any other purpose. You can enter the amount in figures and words, and you can generate the bill. You can also save and print the bill, so that you can save the bill and give it to the patient after printing it. The admin section. The administrator can enter any new user to the software or edit any patient's detail accordingly. In the add user, admin can enter the staff's new name, the password, to which department he belongs, and if it's a doctor, the doctor's department can be entered and new user can be saved.